Minister of Child and Youth Services.
Thank you. Thank you, Speaker. And I rise in the House today in recognition of Children's Mental Health Week in Ontario, being observed this week. This is an opportunity each year to increase awareness of mental health and its signs, and to decrease the stigma associated with mental illness. It's also a time to increase our understanding of the help that is available for those with mental health issues and their families. I can tell you from personal experience that parenting is both rewarding and challenging. I have met parents who are raising children with mental health issues, and I've learned about the hurdles that they have to overcome every day for things that other parents may take for granted. So I absolutely commend all those mothers and fathers for all that they do for their children. There was a time when the topic of mental health was not only considered taboo, but the help and support needed either did not exist or was not accessible. Individuals and families affected by mental health issues suffered alone and in silence. Today, because of broad efforts by community members, organizations, and governments, we are becoming increasingly more aware of mental health issues. I'd like to take a moment to recognize our partners from Children's Mental Health Ontario who are with us here today. We welcome you to the Legislature. Thank you for providing us with the green ribbons that members are wearing to commemorate Children's Mental Health Week. It is through the work of individuals and agencies like Children's Mental Health Ontario that many more people are talking more openly about mental health. And we need to continue to talk as families, as friends, as colleagues in our communities, because not only will that fight the stigma associated with mental illness, it will help us find solutions for children and youth living with mental health issues and their families. We need to talk about it because every young person in this province with mental health issues deserves the support and every opportunity we can provide to help them reach their full potential. That's why I'm proud to be part of a government that introduced and continues to move forward with Ontario's comprehensive mental health and addiction strategy. In developing and implementing this strategy, we continue to work across government and with all our partners, including the Ministries of Health and Long-Term Care, Education and Training at colleges and universities, to create a system that delivers what young people need, when they need it, as close to home as possible. Our goal is simple: to create a more coordinated and responsive child and youth mental health system across the province. Speaker, our strategy focuses on children and youth first because we know that 1 in 5 young people in Ontario today is dealing with mental health issues such as anxiety, depression, schizophrenia, and eating disorders. We also know that 70% of mental health and addiction problems begin in childhood and adolescence. Early identification and intervention is key. It can put children and youth back on track, leading to better health outcomes and improved school achievement. That is why our government continues to strengthen our investments in child and youth mental health. New investments that began in 2011 will grow to $93 million annually at full implementation, and our strategy is working. Already, approximately 35,000 more children and youth and their families are benefiting from quicker and easier access to mental health services and supports. These are being provided through over 770 new mental health workers in schools, communities, and youth courts across the province. Speaker, an unfortunate outcome of mental illness is sometimes suicide. That's why our government is also focused on prevention and has engaged in dialogue with experts and those with lived experience of attempted suicide. Youth suicide prevention strategies are now integrated in community resources and training. Speaker, as we implement the strategy, we continue to work with our Aboriginal partners and communities to provide culturally appropriate mental health services so Aboriginal children and youth can reach their full potential. Our new investments include funding for more than 80 new Aboriginal mental health and addiction workers in high-needs communities, which are expected to provide additional services to 4,000 more Aboriginal children and youth each year. Speaker, we've come a long way in reducing stigma related to mental illness and in supporting children, youth, and their families. We need to continue to work together with all our partners, those affected by mental illness and their families, agencies, organizations, clinicians, and different levels of government to keep the momentum going. I want to thank all those who work with and on behalf of children and youth with mental health issues. Your compassion, your strength, your dedication are a powerful contribution to children, youth, and families you serve and the communities you live in. Thank you for your daily commitment, for caring, and for being part of the solution. Thank you, Speaker.